Hello, this is Dr. Grant Ely. Today we're using the lab results trainer to simulate CBC results. So let's take a look at that. Great. So you have the option of putting in groups of labs such as maybe diabetes or sepsis or whatever it is, a specific lab panel like a CMP or CBC, or a specific lab you want. Today we're going to focus on CBC. And as a nurse, I love to be able to know what's happening with my patients, and learning to read lab results and interpret them and turn them into action is obviously super important for us nurses. So let's see what it has to say. So as you can see, it provides a definition of what a CBC is and why it's important, such as anemia, inflammation, clotting issues, and so on. So we're going to focus on a patient scenario. And so ReadyRNs is now drawing up a simulated situation involving a CBC. So here we have patient information. Name's John, age 68, male. Current symptoms: fatigue, weakness, shortness of breath on exertion, and occasional dizziness. He has diagnosed chronic heart failure and chronic kidney disease. Medications are lisinopril, furosemide, and erythropoietin. Relevant medical history: hypertension, hyperlipidemia, previously diagnosed with anemia. So let's take a look at his lab values. We can see that the white blood cell count is, here's the normal limits, is within normal limits. Red blood cell count is a little low. Hemoglobin is low. Hematocrit is low. Platelets are within normal range. So it says, please interpret the lab results and describe appropriate nursing actions you take based on this scenario. Well, what if I didn't know? I can at least, as a nurse, I can tell, well, these lab results are low, probably looks like anemia. He was diagnosed with anemia before. He is feeling fatigue, weak, short of breath, occasional dizziness, all kind of things that may point to anemia. But we could say, I think it is anemia, and you can write however you wish, but I'm not sure what to do about it. So as you practice these scenarios, ReadyRNs can teach you what to do. What are best practices? It depends on medical journals, case studies, protocols, best practices for nursing. And so it says, ReadyRNs, let's break down your interpretation. You're correct on suspecting anemia based on John's lab results, specifically the low hemoglobin and hematocrit levels. However, there are critical components to consider as a nurse for comprehensive assessment and appropriate care. So identify the type of anemia. Given John's history of chronic kidney disease and the use of erythropoietin, this could indicate anemia related to kidney disease, often due to decreased erythropoietin production. It's essential to understand the underlying cause of his anemia because treatment may vary. Great point. Monitor symptoms. Assess John's symptoms more closely. If he's experienced significant shortness of breath, weakness, or dizziness, these need to be prioritized. It might be valuable to observe his vital signs, oxygen saturation, and level of consciousness. So next time, if we have this situation, we could write those things in. Review medications. His current medication regimen is crucial. Erythropoietin is typically used to manage anemia and chronic kidney disease. Assess whether the dosing is appropriate and if there has been any recent adjustments or issues with adherence. And communicate with the healthcare team. It's vital to collaborate and notify the healthcare team about John's condition. Considering a possible need for intervention such as iron supplementation or transfusion may warrant discussion. Educate the patient. Provide information to John about his condition and encourage him to report any worsening symptoms or new changes. And now ReadyRNs is going to go over the lab results. So white blood cell count is within normal range. No current signs of infection or inflammation. So it tries to help us to understand maybe what typically a white blood cell count that's out of range normal range might mean. Red blood cell count is low, which supports suspicion of anemia. Hemoglobin is low, confirming anemia. Hematocrit, also low, supporting anemia. Platelets within normal range, which suggests adequate platelet function. So potential causes of abnormal values, anemia, likely due to his chronic kidney disease leading to decreased erythropoietin production. Other potential causes could include nutritional deficiencies like iron, vitamin B12, or folate, or blood loss, which would need further investigation. So nursing actions kind of gives us a summary. Assess vital signs and oxygen saturation. Monitor for symptoms of anemia such as pallor, fatigue, or tachycardia. Review medication adherence and effectiveness of erythropoietin. Discuss with the healthcare provider possible treatments for anemia, such as iron supplements or blood transfusions if necessary. Educate John about the importance of protein and iron-rich diets to support blood health. Plan for regular monitoring of CBC and renal function tests. Feedback on your response. Your identification anemia was correct, which is an essential aspect of patient care. Woohoo, we did it. As you move forward, ensure to take a holistic approach by considering further assessments, potential causes, and collaborative treatment plans. Understanding the implication of lab values and the patient's condition will prepare you for patient care more effectively. Do you have any questions about the scenario, or would you like to explore a new scenario? Well done. Well, today we were able to at least identify that John has anemia, which is a fantastic step, super important as nurses. And then we also learned several other steps that we could do once we figure out from his lab results that he has anemia. Well, I hope you enjoyed that and wish you happy practicing. Thanks.